Happy New Year. It is 2024. Welcome to another bonus episode of Dr. G at the Heart of Healthcare. This is episode 36, Finding the Best Hospice Agency. And I have a returning guest, Nurse Gerard. Hello.
How are you? Nice to see you, Dr. G. Happy New Year.
Yes, Nike just do it, huh?
Yep.
All right. Well, we want to help everyone today just do it and find the best hospice agency for you. So, my special guest here, he was with me on episode 19, telling us about how he took care of his wife, who was also a nurse and an educator, and she suffered from Alzheimer's disease, and we're actually approaching her deathversary. How's
Yeah.
that?
It's this time of year, Jean went on hospice on Veterans Day
Mm-hmm.
and died on January 14th. So every year, kind of this time, I remember. And at this point, Jean was staying in bed, and things were good. Things were very quiet, and yeah.
Well, we addressed, deathversaries, also people, caregivers like yourself taking care of their loved ones, and also those who may have, you know, just recently suffered a loss during our holiday episode. So anyone listening, if you want to go back, you'll see some resources about how best to use your time when your loved one is still with us, but also when you're having these holidays that come around, because they're not always happy holidays, and that's okay. So thank you for everything you shared about your wife. So if you're listening, you should go check out episode 19 because we had a good old time.
Indeed.
Yeah. So today we want to talk about helping you all be empowered to find the best hospice agency, because people often just get whichever one the doctor wants or whoever wants, the case manager, but we want the power to be with the consumers. And so that's why we want to teach you what to do. So let me just start with the story and then we're going to just jump in. So, well, actually, I want to start with that amazing quote that we had that said, in the past, we could assume that, you know, the hospice agency that we were seeking care from was going to provide good care. And that's not always the case. And so, what was her name? Naomi.
Oh, I didn't I didn't
I
bring up
have
the
it here.
presentation. Yeah,
I found it.
Niedermeyer.
I have it. I have it.
Yeah,
It
yeah,
says for a long time, we could assume that every hospice provided high quality care. There came a time when that assumption was no longer safe. You have to become a very savvy consumer about what is likely to be the most important healthcare decision you make in your life.
yeah. That's quite a statement.
Woo! So
Yeah,
that's why we want you to be empowered before you need to make the decision. That's why we have that real deal book, right? But also when it's time for you to decide, we want to give you the steps. So let's jump in. So why are we here? There was a story. The story today is from a Facebook group that I belong to. And there was a lady, she said she was actually praising hospice care, this particular lady, and she just said how thankful she is about for hospice, and there's such an amazing group of nurses, aides, and social workers, and they were very kind and loving to her and her mom, and she doesn't know what she would have done without their love, help, and knowledge. And one of the mom's nurses brought banana bread, one of her mom's favorite treat, and she was just saying how they're heaven sent. She was having one of those warm and fuzzy moments. Well,
yeah,
someone hopped on there and said, "You're lucky. Our team was awful." So that kind of went, whoa,
yeah.
oh my gosh. And so I reached out to the lady. I wasn't able to get her on the podcast because I really wanted to hear from her to see exactly what it was, what the failures were. But I just think it's so tragic that you only get one chance,
Yeah.
and you can't fix it.
No, and that's true. And you talk about being a consumer. This isn't something that that most people will jump into. Like, oh, I think I'll research hospice as a topic, and then I'll explore what the available options are in my community. I mean, that's not something anybody's likely to think about. And then there's also the question of where do you even start? Um, and it is, I don't think that's an overstatement about the most important decision, because unless you're able to like switch gears in the middle of a bad experience and somehow find an agency to help make it right, it's like landing a plane. You get your best shot, and then so
Yeah,
yeah.
that's nerve-wracking. When you said that, that was an appropriate analogy. You said it's like, when a plane crashes and everyone, most people are terrified about that.
Yeah.
You can't pick up the pieces and put it back in the sky. That's it. And so, you know, um,
And what you're left with after a plane crash is the people walking around on the ground, afterwards, just trying to figure things out. I mean, that's like the people. I mean, Jean died, and for all intents and purposes, her troubles were over. And then I had to face, being bereaved and everything. So the echoes and implications are just really enormous. And you know, I really do get like a feeling in the pit of my stomach when you describe, you know, uh, you described a recent instance where someone was unaware that they had a 24-hour, a line a phone call that they could that could make for help. They thought that they had been abandoned by their nurse who was on vacation or something. I mean, that's to have those kinds of thoughts going through your head at such a difficult time. Um, this is big stuff, and I'm getting tongue tied here.
yeah, yeah. So that audience for you wondering who that is, someone reached out to me. They were terminally ill hospice patient over the holidays, and they said they were in pain, they couldn't breathe, and they were considering medical aid and dying. And they also mentioned that their nurse was on vacation for Christmas. And I said, hey, the hospice agency has 24-hour availability. And they seem not to know that. And so again, that's a failure of communication. So let's get into the info.
Absolutely.
So
Yeah.
so back to this particular lady who said she had an awful experience. Some of the folks, gave her advice, oh, well, consider, sharing that on the survey, the survey that we get. Well, that the primary caregiver gets. But again, we want to prevent those awful experiences. And so you can be empowered to make the best choice for your family. And so that's why we're here. So let's go ahead. So
Yep.
let's start with some of the red flags we might see before we get into the 5 steps. We're going to have 5 steps on finding your hospice. So I have one.
Okay.
When a facility or community says we use this hospice, it's their favorite hospice. I mean, that may not be bad because I know how hard some reps work to build those relationships, but that takes the power away from, again, the consumer, and we want the people to have their needs met and it to be patient-centered care. You have any
Yeah.
red flags?
If yeah, just to build on that. So yeah, so if someone at an assisted living facility or in a long-term care facility says, "Oh yes, we work with this one hospice," that's worth exploring. It could be a great thing. Like we work with this hospice because we've worked with lots of them and they're clearly the best and we have a strong relationship. And they're, in fact, here's someone from the agency visiting now. So that could be a good thing. But I mean, at the other end, it could be, yeah, we recommend this one because there's something happening, under the table or whatever.
Yeah. Yeah, we want to keep patient-centered care. You
Yeah.
mentioned a couple things about there being chaos and lack of continuity.
I
Um,
think I think a key. key element of good hospice care is continuity. And that means seeing the same people, not necessarily the same person, I mean, but the same nurse or one nurse and another nurse, the same social worker, the same spiritual care person, the same, home care aide, just seeing the same people, the same team consistently. And when there's a change from that, there's kind of like a reason, like, oh, I'm a nurse who works just evenings and nights for special emergencies. Your daytime nurse is off right now. So consistent staff, and also just consistency in how they speak to you, and also, the answers that you get. When you talk about difficult cases, I mean, there's certainly a number that I'm familiar with where, in the midst of a merger, in the midst of two agencies merging together, you've got two groups of staff coming together and lots of kind of noise on the ground, but still the daily work continues. A family in that situation might be getting different stories from different people when they ask the same question. And that's definitely a red flag. You don't want, again, I'm sorry, I'm getting tongue tied for a
No, you're
podcast.
fine. You're fine. So I'll just list some of the things that we discussed while we were preparing this episode. So you told folks, follow your gut feeling. You have a story about, some patients, they go to the emergency room, straight to the oncology referral and straight to the hospice. That could be a situation. I'll let you comment on that in a second. If the staff is in distress when they're visiting because they're so overworked, maybe they
So
have a huge caseload, their visits are delayed. There's not enough staff, and everyone knows we're in a staffing crisis in healthcare. If there's case managers that are doing the admissions, and there's off hours coverage issues, like we mentioned, and also changing ownership. Those can be a lot of challenges that people have. So you had a story of someone with pancreatic cancer or something. Where's
well,
the situation?
sure. And those last few items, that you touched on, those all threaten continuity. Uh,
Mm,
you know, I mean, picture this scenario. Someone is at home, they're not feeling well, but they don't do a lot. They don't see doctors very often. Finally, they do go to the hospital. They do go to the emergency room because their abdominal pain is just too bad. And they went from not feeling good to being told that they've got an advanced cancer with, a very, very grim prognosis. Um, and so now you've gone from discomfort to having your life turned completely upside down. And also, say, an oncology team or a primary care team also kind of starting to do all hands on deck. So now there's a lot of activity. Um, and let's say after a few days of tests and talking to oncologists about chemotherapy and all that stuff, maybe the decision is no, let's go home and be comfortable on hospice. Okay, that's a great plan. But if in reality the hospice that you're handed off to is in the midst of this kind of chaos, from merging, and people aren't talking to each other, and you're getting different stories and you're seeing different people and you're encountering the kind of things you just described, of people arriving at the house much later than they said they would and being all upset. I mean, all of that kind of piling up is not good. And that case in particular, when someone is so acutely ill and things really are a crisis, you need exactly the opposite. You need someone who can come in and get their arms around the situation and really support that family in what can turn out to be, a few weeks, a very short
yeah.
lifespan. So
Yeah, not much time to take care of them. While we do we have to do it fast. Um, so yeah, so what we're gonna do, audience, is I'm gonna share the 5 steps here, and we're gonna put the link to the resources in the show notes like we always do, but there's going to be a separate video demonstration that accompanies this podcast. So if you're listening to this while you're sitting in traffic, just know that there will be a demo of the 5 steps that we're going to jump into right now. So let's go ahead and educate them. So, and first of all, will you tell us how you came up with these 5 steps? Like, where'd that come from?
Well, it's just the idea of I spent a lot of time in the field and kind of have an understanding of how actually backtrack. This is how it started. I was asked by a colleague in 2018, I think.
Mm-hmm.
She was calling for a family member, and the family member was looking at hospice, and they lived in a part of Massachusetts that I'm not familiar with, not directly familiar with. And she was looking for some guidance. I said, let me see where to even start. And this was just before Hospice Compare and Care Compare came out. And so
Mm-hmm.
I ended up doing a Google search, using Google Maps and finding hospices kind of in that community, and then kind of going step by step and saying, okay, these I know, and kind of like, here's their backstory and their strengths and weaknesses. These I don't know, and this is why they look kind of weak. So it was in specific request, it was in response to a specific request to help somebody. And we
Nice.
did kind of get through to a point where it's like, oh, okay, great. Yeah, that looks like the one I should talk with first. Because the challenge was there were 20 or 30 hospices available. Where do you even start? And we sorted through that, found one that was worth talking to right away, and a couple others that as backstops. And the end of the story was she went with the first one, and things worked out well.
Yeah. Well,
It
good.
was
Well,
that process. Where do you even go?
where to even start? Well, we're telling you today, here are the 5 steps. So, first step is use Hospice Care Compare. You got to get on the computer and get into this website. So
Go to
you did a Google search back then, but now there's a Medicare website for this, correct?
Oh yeah, it's the Medicare website itself, Medicare.gov, and you go there, and there is Find Providers, and you click on that, and providers could be hospitals, skilled nursing facilities, physicians, physical therapy outfits, home care, and hospice. So you would choose hospice.
All right. Yeah. And the link in the show notes is going to be specifically for hospice. So you start there and get your short list. So, again, we're going to get into this a little bit deeper during the demo part in a separate video. But basically, you go on there and you put in your zip code
I think
and
zip code is the best. Yeah, put in a zip code, and it'll respond back with the hospices that serve that zip code.
yeah, and it may be a ton, but you can narrow it down to profit and not for profit, which we'll get into more later. Um, there's a lot of debate going on about that. I don't know if you have any comment on that.
Well, if you just do a search on your zip code, I mean, if I searched on a Dallas zip code, I would get over 100 uh, separate agencies. And where do you even start? So the first task is to sort through that quickly and find the small handful that you really want to spend time exploring more, and just forget about the others. Just you know,
Okay. Okay. All right. Number 2, once you get that short list, then you focus on the star ratings, which come from that survey, and the other characteristics of the agency, such as the size of their census, the location of care, the medical conditions that are primary part of their census, and the length of time that they've been in business. So those
yep.
star ratings are based on the same survey, right? That we were talking
Yeah.
about earlier.
Yeah, so so if the first task is to go to Medicare.gov, grab up a handful of hospices and let most of them fall through your fingers so that you've got the 3 or 4 or whatever that are worth looking at, then you can compare them to each other. you can see that one has been around for a lot longer, or that one is quite large and the another one is quite a bit smaller, or you start kind of like sorting through your options, and maybe in that process there's a few that you kick out, like, okay, yeah, I don't want to look at them further for whatever reason.
Because they
And
have
then,
1 star.
well, no, ideal, no, you don't even, those are the ones that fall off the table right away. You don't want to spend any time on an agency that's rated like one, or anything less than 3 stars is my guideline. Yeah,
Okay.
you want the upper half.
Okay.
Uh,
Okay. And then just for the audience sake, the data on this website is behind a little bit.
yeah,
Maybe
sometimes by a calendar quarter,
okay.
depending, and there is like a little timestamp as far as
Okay.
like when the data was last updated, but yeah, it's not going to be as of yesterday.
Okay. Excellent. All right. So number 3, once you have your short list and you've gotten rid of the 1 star ones and you've focused on the for profit or not for profit, whatever your criteria is, you don't want the ones that have a 600 census. Maybe you want some that have a more manageable census. And once you have that number, then you check out their websites, their social media, their Facebook, their Instagram, their YouTube, Twitter, X, Yelp, Indeed. See if their staff is listed. How does that help the listeners?
Well, it's once you've identified with Medicare.gov, like, okay, this looks like my best candidate, or these look like my best 2 or 3, then you start looking outside of Medicare.gov. And the agency's own website can tell you a lot, or it could tell you nothing. It could be boilerplate text and stock photos that really isn't all that informative, but that can also tell you something.
Mm-hmm.
Um, but also looking at other sources. Yeah, are they out on Facebook? Are they doing anything regular on social media? Are they putting out short videos that are helpful? Like, did they put out a 2-minute video just before the holidays talking about grief in the holidays?
Mm-hmm.
So kind of seeing what else they have going on, um, without kind of like leaving your chair, or
Yeah.
without talking to anybody else, but just kind of
Right.
like, okay, see if we can round out the picture. Um,
Yeah.
and it
Yeah.
may or may not make a difference. It certainly can highlight a difference between different options.
Yeah, and I want to say, some of you may not be able to make this decision way ahead of time like we hope, but maybe the hospital has provided a list of hospice agencies for you because they're supposed to give you an option. I know my husband, when he was dealing with his dad, he got a full page. And so you can start there and kind of narrow it down using the steps that we're giving you today. Or if you live in an assisted living or memory care and they're saying to you, hey, these are the 3 hospices we like. You can, use them,
Mhm.
with this method. So moving on to number 4, once you have that and you know who you like, hopefully you're down to 2. Set up a visit or call them. Now, I want to say about the visit. Well, first of all, the reason you're doing this is to verify the information that you come up with. But what we want to say is don't sign consent if you invite them to your house because then you're kind of signed on with them. Go ahead and verify your information, learning about their staff availability, the caseloads, like we mentioned about the lady during the holidays didn't know about the 24-hour care. Verify your info there. Would you say?
And it's also, if you're talking with someone from the agency, you can learn a lot about the agency by the person that you're talking to. I mean, they're representing an agency, and I know in the places that I've worked and the places that I've been that there is a difference in kind of who you encounter with these kinds of phone calls. I'm thinking of one agency and who the person is likely to talk to, and they're very helpful and they're very open. They've been doing it for a long time, and it's a very comfortable interaction. Um, but that's unusual. Um,
Mm-hmm.
but I think in general, you want to talk to the agency itself. You do want to ask some hard questions. What are your you know, what's your census? What's your staffing? What's the average caseload for a nurse? How many? This is actually a question that the Medicare.gov form has available that it asks, how many other patients will my nurse have? Will I have the same hospice nurse? And how many other patients will my hospice nurse be responsible for? So there's continuity and workload right there. Who else from the hospice should I expect to visit, and how often?
Mm.
Those are helpful. I advocate for using the resources that are available, that to be limited to be working with an agency and to have just like one point of contact all the time. It leads you to trouble. Like that woman that you described, if she had had contact with others, should have a better understanding of what the agency offered. So,
Yeah.
um,
Yeah.
yeah,
Wow. Okay. So, ho- you know, I know when I'm having hot flash here, I need to get my fan. So I told them not to sign the consents when they're verifying their
right.
info. Any comment on that?
Yeah,
Got a purple
yeah.
fan.
Thanks for reminding, because yeah, absolutely. We touched on briefly for profit versus not for profit, and listeners may not be aware that hospice began as a movement in the late 70s and early 80s in the United States as a community-based, not-for-profit movement. But once Medicare funding became available, there's been a steady growth in the number and scope of for-profit hospices, to the point now where 70% of hospices operating are for-profit. That's the vast majority. So the idea of someone coming to your home, well, let's do it this way. Let's talk about hospice, but talk about it in business terms. Um, you know, if a physician refers a patient to a hospice, the for-profit hospice considers that's a qualified lead. That's a sales lead. I've been handed a lead on someone who's willing to sign up for hospice, someone who's willing to buy. And so getting them closing the sale means getting admitted. And so what you're saying is, if you have someone coming to provide you with information, don't let them sell you something. Don't
Mm,
sign anything. And
mhm,
that's
mhm,
it's kind of a difficult way to think about this, but I think from the for-profit side, it's definitely how things are. I mean, working in a for-profit setting, it's let's get admissions up, let's increase sales. Let's
mm, mhm,
expand our referral base. Let's expand the base of where we can get qualified leads from. Um,
mm.
that's the thinking.
Yeah, well, I mean, unless these, agencies pass your test and check off the list, then, that's why I would say hold off. I don't want to get into the, for profit, not for profit, you know, debate, because it's the world we live in, right? But we really want to empower you to get
Right,
the best health care at the end of the day,
right.
and
And
patient-centered care.
can I point out that when I mentioned in Dallas, you would get, say, 100 or so hospice agencies, they would be overwhelmingly for profit. And so, in searching for the best hospice for that zip code, there were several for profit options that were highly rated, that had couple of them had very informative websites. One had a very strong community identity. Um, they were all still operating with that model of having some money left over, but amongst for that zip code, the best option appeared to be a for-profit, and it all
Hmm.
seemed fine. We checked out the not-for-profit options first off, and there really weren't any. So that's
Interesting.
that's
That's
that
good.
that's that environment.
Right, right. So now we've made it to step 5, choose one. We called it A, but have a plan B. So go
Definitely
ahead
close
and
it.
make your selection, but have your second choice there, because if you remember from our episode about the hospice regulatory myth busting, you have the right to transfer hospice agencies without losing your benefits. So if you hop onto one and it's not going the way that you would like, you can transfer to another one, and that can be your plan B. So that's step 5.
Yeah, and just to echo that, one of the worst situations I was, witness to was a grieving spouse a number of months after their loss, where they were able to write a letter and complain. Um, they said, "I really regret that I didn't follow my gut instincts that first night when things were off to a bad start. That if she had had a plan B, perhaps pivoting to plan B could have pulled things out of the fire." That's
Mm,
uh, that was her biggest regret, that she didn't follow her instinct
mm.
after that first night.
Wow. Well, those are your 5 steps to empower you. We have the link to the Medicare website, and also we'll have a handout available for those of you who like to write pen to paper like me. You can take your choices and write them there, but we'll also have a handout. Also of note, once you do this search on the computer, you can print out your results. So you don't have to write anything for those of you who want to save trees. So those are the 5 steps. So we're going to hop on into the demo. Did you want to have anything else to wrap this part of the podcast up?
No, I think no.
All right. All right, everyone. So thank you for joining us in episode 36 about finding the best hospice agency. Actually, you say choosing the best one. So finding and choosing the
I can
best
choose.
one, 5 simple steps. So our next bonus episode is actually going to be about medical aid in dying. So you want to be ready for that. Make sure you have your notifications on. And remember, the Real Deal About Hospice book is still available so you can learn about the conditions that are covered and how patients and family benefit from the advantages. So thank you for joining us. Peace.
Thank you.